We're taking you deeper into the impact of the coronavirus. Tonight, I'm joined by Dr. Ali Hassoun, an infectious disease specialist at Huntsville Hospital. Thanks for being with us again, Doctor.
Thank you.
As we just heard from Sydney, local restaurants don't expect their business to pick up until they can get customers back into their dining rooms. And are we in a place, do you think, to do something like Tennessee, to have limited opening of restaurants and other close contact businesses?
My thought about this, probably if we maintain our rates and see decline in our rates in the next few weeks, it's going to be possible. The issue with restaurant where you're going to be having crowding, you're going to need to maintain that physical distancing, and then it come up, are you really going to put face masks for everyone? Are they going to wear gloves and stuff? So logistic can be difficult. I'm hoping in 3-4 weeks, as we try to keep up with our essentials of physical distance and hand hygiene, with time I think probably it's possible, but we need to pay attention to these essentials.
So when it comes to reopening a dine-in restaurant, run over those safety procedures again, how it can be done safely.
It's really going to be depending on what's the rate of infection around the area, and if we really trying to open up, it's going to be important the safety of whoever works in that place, to be screened for any symptoms and signs every day. And then customers wise, there's going to need to be, to start with, some distance between the customers, between customer and who works there. Also pay attention to the hygiene and reduce exposure. So if we can try to do that, it's a possibility. It's in a COVID world. It's not anymore that as we used to, till we get our rates significantly lower and we can get back to the normal, hopefully.
We've been reporting today that the Trump administration rejected the CDC's guidelines for reopening the country. They said some of the restrictions went too far, they were too stringent, and administration officials said guidance in rural Tennessee shouldn't be the same guidance for urban New York City. And there seems to be some truth in that, but as a medical professional, what do you think of the White House rejecting the CDC's recommendations?
So, part of it is true. You cannot treat each county or city the same, because again we really go by the prevalence of infection. But I can tell you, when issue comes up, sometimes is we don't know the prevalence because we're not doing testing as well. So that's very important, because what's popping up now in rural areas of the country, there are cases not counted or we don't know about it. So what to do about that is actually getting more testing available, so we'll know what that prevalence, and by knowing that, we might be able to say this part able to open up with less restriction in compared to another one. The puzzle is we don't know the prevalence in each place, and that's why we need more testing widely available.
So I'm going to put you way out on a really thin limb. Do you think we're ready to reopen? I've talked about that before. I thought I think we reopened a little bit early than it's supposed to be. I hoped around mid-May after that, so we can see more reduction in cases. We are already in phase 1 of reopening, and again I'll go back, we already open, we're trying to get back to normal. What people forget about, it's not yet the time to do, for example, big gathering, or birthday parties and pool parties and stuff. We are not ready for that. We need to keep the minimal gathering, the physical distances for a few more weeks, so we hopefully can get back to normal as much as we can. Now, these national models that everybody quotes, especially ones that hold a great deal of sway and influence, like the Institute for Health Metrics and Evaluation, they're showing these national and state numbers skyrocketing lately. Just this week, in fact, the number of projected deaths doubled nationwide, over 134,000. The number of deaths escalating here in Alabama as well. I mean, the number went from a projection of less than 300 here in Alabama to over 2,300 overnight. Is it because of more testing, or is there a backlog of testing that's come up?
I think it's two factors. One is going to be more testing and more exposure as well possibility.
And the more number of testing with positive patient, the more likelihood some of these going to get admitted to the hospital, and fortunately some of them will die from this. So it's testing, but it's also more exposure as well. There where we're going to see increase in these patients' population.
What do you think of these models? Should we be relying so heavily on them? They seem to be
I don't
wrong,
think
honest to gosh. They just seem to be wrong.
I agree with you. We really cannot depend on just math to calculate what's the possibilities. Because in each area there is differences in the way of how people behave, what they do, you know, how much infection in New York is different from how much infection in Huntsville area. So to apply these models the same for each area, it will be wrong.
Yeah.
You cannot do that.
Recent Associated Press story says how much coronavirus will hurt rural America, and we know areas surrounding Huntsville will be impacted. What do you think about some areas of North Alabama, smaller cities, Decatur, Gunnersville, and Florence?
Yeah, and I can tell you from the beginning, because there's a Huntsville health system that have multiple hospitals around that region, there's been approach to try to tackle this from the beginning. There is actually outreach, mobile clinic to try to test in some of the areas where you think it's vulnerable. So it's been thought about to try to reach out and prevent widespread transmission and try to tackle these and track the earlier infection to reduce these chances.
Yeah, a lot of these rural communities, they're at a greater risk. They tend to work in jobs that don't do social distancing. You can't process chickens from home, for example, that kind of thing. And they seem to have more comorbidities. They have they're overweight. They have diabetes. Some of these numbers are higher than in urban areas.
But see, Dan, that's why we're saying if we can find earlier infection and track and trace them and quarantine them, we're probably able to reduce the transmission, reduce the infection rate in these areas. And I think it's possible. It's a matter of all of us as a community, if we see anybody sick, get them to see their doctor, get tested, look for it. And by doing it, we're really going to be able to cut down on cases.
All right, thanks, Dr. Hassoun. Stay with us. We're going to take a quick break. When we come back, we'll look at what it might take to achieve herd immunity and how testing could expand when we return.
Coverage you can count on. You're